Hello there, this is Dr. Mintz. This is a patient I encountered in the past who has had a history of Crohn's disease and came in with lower abdominal pain. I'll give you a chance just to kind of peruse this from top to bottom. Okay, and we'll go over a few points. First of all, if you look at the liver, you can tell it has a relative low attenuation. It's usually pretty close to the spleen in terms of attenuation. This looks much lower in attenuation. This you've probably seen. It's called fatty infiltration of the liver, also called hepatic steatosis, and it is a reflection of a number of things, including obesity very often. Alcoholism can produce this as well, or just alcohol consumption, and it does put the patient at higher risk for certain problems, including a hepatoma or cirrhosis. So that's the liver, low attenuation, hepatic steatosis. We see it on ultrasound as a brighter or higher echogenicity of the liver. So that's called hyperechoic. It's a high echogenic or bright appearance on ultrasound when the liver is infiltrated with fat. Remember, fat has a low attenuation, as you see here. It's dark. And so the more fat you have in an infiltrated organ, the lower attenuation you'll expect it to be. Okay, and here we have a nice view of the pancreas. And here's the pancreatic head, would be this area here. This is the uncinate process that wraps around the main portal vein, or actually there it's the superior mesenteric vein. And here's the body of the pancreas. You can see a little bit of the duct, and if you follow it distally, lo and behold, it takes you to the spleen, right here. Okay, so this patient had Crohn's disease in the past, and I thought, well, look, here we have the terminal ileum, and it's got these thickened segments, like right here. See, this is a nice thin border. This is a thickened wall involving a segment of terminal ileum. Here it looks like it is circumferentially thickened, but you don't really see any stranding around that. Here we have that distal part of that area that's thickened, and still a little bit more of it there. And then we should be coming into the ileocecal valve. Well, this patient has a cecum that's up high, a lot of variations of that. This cecum is quite high, but this is the ileocecal valve somewhere in there, right here. Okay, that is where that is emptying into the cecum and right colon. But I wasn't that impressed with that. Even though it looks thickened, usually it looks lower attenuation, boggier, more edematous, and with this much bowel wall thickening, you would really expect to see, some shagginess around the border, some ill-defined margin, some stranding into the adjacent fat, and you could argue maybe there's a little bit there, but that looks like vessels, and once you get above and below that point, it's not as impressive. So, has signs of Crohn's disease, probably some chronic thickening of the wall of the bowel there. Then I looked at the old study and I realized the patient had had proctitis, inflammation of the rectum before. So we go down here and I think, well, this is pretty good looking sigmoid colon. Here is rectum, and not too bad. And then if you keep looking though, oh my goodness, here you've got this big donut of a thickened wall of the lower rectum. And very importantly, look at the edema, look at the stranding or the fuzziness of the fat. That perirectal fat, has no reason to be as shaggy and light in attenuation, in other words, kind of higher attenuation because of the water infiltrating the fat, There's just no good reason for that. It should be dark, 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 like this. But it's not. So this is edema, and this is a very thick wall in the rectum, and this is proctitis. And we usually think of small bowel involvement when we think of Crohn's disease, and that's usually the case, small bowel, especially terminal ileum. Far and away the most cases of Crohn's disease I see have that terminal ileitis, edema, thickening, stranding at the terminal ileum, and it may be a little bit here and there also, but it almost always involves the terminal ileum. But we're told sometimes it can involve the colon. I've seen that a couple of times. But since this is recurrent in a Crohn's disease patient, I have to believe this is Crohn's involvement of the rectum. So fairly uncommon process. And then we can see this on coronal images too. And let's see, here we go. So here you can see the rectum and as we go through it, it's not as easy to see, but here you can see this is fat above that level, more proximal rectum. This is all rectum, and this is that stranding that we saw in the perirectal fat. Okay, that's it.